My contribution to Rural Healthy People 2030 was in a couple different ways. I was part of the original team that conceptualized the Rural Healthy People 2030 project, and I helped to lead the survey at the center of the Rural Healthy People 2030 project that helped us to identify what rural health stakeholders believed mattered in terms of the most important health people priorities for rural America. So I helped to lead that effort, met with lots of organizations that helped to disseminate our survey, and worked closely with our grad students at Texas A&M University to make sure we had a good understanding of those top 20 priorities. From there, I was involved as an author, helping with two different chapters within Rural Health People 2030. I served as the lead author for Chapter 3, focused on healthcare access and quality. And as part of that process, I worked with faculty members as well as graduate students to try and provide a picture of the ways in which rural health has changed in the area of healthcare access, and in fact, the ways in which it's improved. And the final way I was involved in Rural Health People 2030 was to serve as an extra voice and extra author on the chapter focused on cancer in rural communities. So combined, I was quite involved in the project, both helping to conceptualize it initially, leading the survey work, and then serving as an author on multiple different chapters. One of the things that really stood out to me and surprised me over the course of building Rural Health People 2030 was the changing role of healthcare access in rural communities. Undoubtedly, healthcare access is still incredibly important, and it ranked number 3 in our list of priorities. But the past decade leading up to Rural Health People 2030 was a decade of improvement in rural health and healthcare access. So whereas healthcare access had been the most important priority for the previous 2 iterations of Rural Health People, it had dropped to number 3 for Rural Health People 2030, demonstrating actual progress and actual improvement in rural health in the context of healthcare access. So it was sort of a happy surprise, a happy discovery that improvement has been made. And over the course of working on the healthcare access chapter, we dove into why those improvements have been seen and demonstrated that health insurance rates have improved, in large part due to the passage of the Affordable Care Act and Medicaid expansion within the Affordable Care Act, and then the advancement in certain areas like telehealth. Now, that's not to say healthcare access is fully improved and perfect in rural communities. It's still the 3rd most important priority, with things like rural hospital closures and things like that. But I was really pleasantly surprised to see the improvements in rural healthcare access over the past decade. So when we're thinking about improvements over the next 10 years, I think there's a lot of different places for us to focus on. In the area of healthcare access, I think a lot of work still needs to be done to slow the tide of rural hospital closures. We've had over 140 rural hospitals close since 2010. We've also had many rural health hospitals close certain services like obstetric services. So I think having a considerable policy effort towards reducing rural hospital closures will be a very important next step on healthcare access. In addition, working to reduce those health professional shortage areas in rural communities to make sure that rural communities have access to all of the different types of healthcare providers that they might need. I think those are going to be incredibly important moving forward. And then thinking about the next decade, I think equally important is going to be the evolution of technology, right? How can we better integrate telehealth into rural communities and their access to care? And how can we set up both policies as well as broadband infrastructure to make that a reality, both in the short term and in the long term? So I think those are some real areas of potential improvement over the next decade, as long as there's the policy and political will to make those things happen.